Wonderful. Good morning, friends, and welcome to the Spirit Society of Virginia. We are going to start today with a message from the book Our Daily Bread, psychographed by Chico Xavier through the Spirit by the Spirit Emmanuel. Message 66: Goodwill. See to it what you live prudently. Paul, chapter 5, verse 15. Goodwill finds work to be done. Work leads to renewal. Renewal finds the good. The good expresses the spirit of service. The spirit of service brings understanding. Understanding brings humility. Humility wins love. Love leads to self-denial. Self-denial reaches the light. The light promotes self-betterment. Self-betterment sanctifies the individual. The sanctified individual converts to the world to God. Proceeding prudently through simple goodwill, the individual reaches the divine kingdom of the light.
As simple as that, huh? It's a beautiful, profound message for us. We've been studying this throughout this week, repeating since Monday, Friday. It's all about goodwill. So let us now do our prayer. It's so good to pray. When we see the sky full of stars, we recall the great, wonderful spirits who are watching over us in the name of God. And it's so good to connect with them, with God, to feel the joy of living. So good, dear God, to feel you, the source of love, the source of peace, of kindness, of all good in the universe. We're so blessed to know that you exist. We may not understand you quite well, but we feel you. We did not create ourselves. You created us. And it's so interesting to find out every day ways in which we can feel you closer in our thoughts, in our feelings, in words and actions. We thank you for uniting us, for we all would like to be in your presence consciously. And we pray at this moment for all those who are suffering. Sometimes they may have everything, and yet they are feeling empty. We envelop them, those who are willing to commit suicide, or those who already did, drug addicts of all sorts. We pray for drug dealers, hoping that they feel how they are loved by you, and they will find a new way of living their lives. We pray today especially for those who are plotting against somebody else's life, obsessors, visualizing flowers of kindness delivered to them, giving them an opportunity to feel loved and invited to a new beginning. Feeling your guidance, enveloped by your protection. We thank you for the permission of being here. May you bless our dear speaker Dr. Sergio Thiesen, thank you. So be it. All right. So now we'll bring here our dear friend, Dr. Thiesen. He has a long CV professionally, also in Spiritism. He's in Rio de Janeiro, Brazil. You know, his father was once the president of the Brazilian Spiritist Federation. So he was raised in a family that was not only Spiritist, but deeply committed with Spiritism. And we owe a great deal to his father, who was good friends of Chico Xavier and was instrumental in many ways at critical times in Spiritism in Brazil, supporting also the works of the good spirits through Chico Xavier. And it's such a blessing to have his son here with us, Dr. Thiesen, who made a choice. He became a physician, a cardiologist, a faculty at university, and he built his own family. He has his own children, and yet he is deeply committed with Spiritism. He not only embraced Spiritism for himself, but he shares it with the world. Daily he has his prayer at 5 p.m. our time, 7 p.m. Brazil time, and he has been traveling around the world and now through the internet ever more often, sharing the teachings. And we think one of his greatest expertise is the work with the spirits. Dr. Thiesen is not a theoretical spiritist, because you see many spiritists nowadays, they're great speakers, but they don't go to a spiritist center. They don't affiliate themselves. So we listen to them, but like, what do you know? Because if you don't really work with the spirits, right? You're not there with the people either. But Dr. Thiesen, no, he is in this two-realm work relationship, in these obsession meetings, in mediumistic meetings, and he has a wealth of experience to share with us. And since the pandemic is almost over, or wherever we are getting back to our routines, there is something going on that needs help. Collective obsession. When people are feeling victimized, poor us, because we suffered during the pandemic. Oh, for goodness sake. What is for us anything? We are not. We are no longer children who are victimizing ourselves, though our children here never do, because they're amazing. They're amazing. But usually that's our childish way. Like, oh, what I missed. We missed nothing. Hopefully we found ourselves during the pandemic. And we need to talk about obsession. I won't say more, but to say that we are very grateful already, right, friends? Let me turn the camera so you can see you guys a bit. Right? At least part of us. Okay? So, in this relationship, Dr. Thiesen, we want to know from you. I'm going to stop speaking. Our children will go with our teachers, educators. Thank you very much. And some of us will stay here, right?
Yeah.
That's Gabriel, that's Virginia, that's Sophia, Alice. Yes. All right. So we want to know more, to share more. Dr. Thiesen, I'm going to remove ourselves from the camera. You keep watching us, and I'll put your slides up, okay?
Okay. Well,
My name is Sergio, and I would like to say just now that I am very happy to stay with you again. I remember in other times before the pandemic, uh, I stay with you sometimes in the same location, maybe talking to you about different issues involving medicine, spirituality. And now I am in Rio de Janeiro, Brazil, and I would like to study with you about obsession. So I prepare um, some slides to share with you some kind of resume about this uh, thematic because this is uh, uh, an issue to talk uh, during many hours, and I will try to share with you in something like 1 hour. I would like to ask you if you can hear me. Okay. So, first of all, I would like to uh, share with you something like basic considerations. So, we are learning about spirituality, about uh, the earth, where we have two different words in just one. So we are the same humanity. We are living on earth during many and many millenniums. Um, about the spiritual information from the literature, spiritists, including Allan Kardec, Emmanuel, André Luiz, Humberto de Campos, we are one community of 22 billion of souls or spirits with moral deficiency. So the earth, this humanity, we are not some kind of reference of word. This is specifically case because we cannot understand all the suns, stars, planets, humanities around the big universe as something like we are here on Earth. So we have all of us uh, incarnated ones, but disembodied too, with moral deficiency, gathered together for re-education and regeneration according to the moral and ethical codes of the universe of God. We need to know about this. This is very simple because if you think with me in this world, in this situation, in the majority of the cases, the people around the world, they don't know about this, about where we come from, what we are doing here, what is the proposal to the life, the material life, the life of the uh, life people in the matter with physical body, independently of the religion, philosophy, science. The majority of the people, they don't know uh, what we are doing here? What is the sense of life? What we need to obtain to be a different people in the future, with happiness, with different spiritual development. So, my friends, I would like to remember fraternally with you that we need to know about this. But today, only the spiritists, or in a better sense, the spiritualist people, but in this aspect, only spiritism to give to us the better idea, the best idea in terms of the reality on earth. Now, my friend, I don't know if you know about this. This is some kind of contabilization. We are 8 billions of incarnated, and we are in the we stay with 14 billion of disembodied spirits near us, around us, in the same world. Now we are incarnated ones, but tomorrow we will stay in the other side, and many of them that are now around us in the spiritual realm, they will come back. But we are the same. We have the same characteristics. We have the same difficulties in terms of moral pattern of life. So we need to understand about this. We need, in terms of we are here to obtain our inner enlightenment and substitution of vices by virtues. Because, my friend, we have many problems. We are living many different occasions and situations during our physical life, but including in our spiritual life, in the other side, the same questions. We have the same problems and limitations because of some kind of lack of moral advancement. And we need to study this in the spiritist centers around the world. We need to promote this kind of understanding about life. Because if you don't pay attention to this, we will have many and many more reincarnations, but with so poor advancement during each one. We need to change this. So we need to study many things. So I am hearing during many times, decades, working with the spirits, trying to care of the people with important medical problems, physical problems, mentally disease. We know by good spirits the idea that the earth, this planet, because this humanity, this is a big hospital. Independently of the idea of hospital, we are to something like a primary school in moral terms. We may have a postdoc in some very nice aspect of sciences, but we are dealing with another challenge to our development in terms of inner enlightenment, because these are different things. Science, in a common sense, it's very different, because I know people with so little science graduation, but people with a very important, they are something like light in the spiritual world, with simplicity, with humility, and many other virtues, charity, empathy, solidarity, fraternity, respect, hope, and work to benefit all the people around them. So we need to understand and to think about those things, because this is some kind of poverty in moral terms that are something like one characteristic on earth. So, as you know, in terms of the Spirit's book, we have one idea of hierarchy of words according to Spiritism. So now we are only in a condition of tests and expiations, texts and atonements. But we are very limited in terms of spiritual possibilities, because we are in a prison, not only in a prison in terms of our physical body, because we are incarnated now, but in terms of this prison, hospital, primary school, that we can think about our planet, the Earth. We have a long journey to the future. We are understanding, thinking about hundreds of millions of years to the future. So I would like to remember with you, my friend, in terms of our reality. I would like to remember, because we forget those things. So in the next year, 2022, suicides, 1 million of cases, one more. In this year, we have 145,000 cases just in 2 months. I would like to remember, I could see you utilizing the masks in terms of pandemic. 60, 80 million of cases around the world, 7 millions of deaths. United States, Brazil, Italy, Germany, and many other countries around the world. As you know, I know. But what kind of this? So many suicides, so many people with different diagnoses in medicine, biological, physical suffering because of those different illnesses. And we have a very important and dramatic situation in terms of mental disabilities, mental diseases around the world. We are talking about depression, generalized anxiety, schizophrenia, drug dependence, autism, spectrum disorder, and many different other in different statistics. Why those so big and impressive statistical remembering to us? Another problem we have, this is the big one. We have in the year ago, 2022, 42 million of induced abortions. Now this year, 6 million in 2 months around the world. This is suffering. This is obsession. This is trouble, spiritual problems that we are suffering, but in the same way, with that we are causing to ourselves, to our future. This is some kind of dramatic legacy to the next centuries, involving all this humanity, including the people that are reincarnated, and obviously the people that are living in the spiritual realm. We need to understand the consequences of the obsession. Obsession in terms of spiritism, the action of discarnated people influencing the people around the world. But not only, because the reverse, we have people in this condition, incarnated ones, influencing the discarnated ones. So we have some kind of mixing, some kind of double kind of interactions in terms of thoughts, feelings, choosings, actions from our history to nowadays and from now to the future. We need to know, for example, I am a physician. I am working the frontier between both sides of life. When we open in a meeting, mediumistic meeting, with mediums and doctors, case by case, the cases that comes to us in the spirit society, for example, not only. For example, one case of depression with 2 or 3 attempts of suicide, or another diagnosis, a little boy, 8 years old, with autism, a moderate or severe case of autism. Always, I do not have one case during 40 years for decades without obsession. But not only in terms of medical diagnosis and medical problems, in terms of internal medicine, cardiology, neurology, psychiatry, neuropsychiatry, but in terms of suffering. All of the different expressions of suffering that comes to us in my office, in the office of many colleagues around the world, and in the spirit society. And when we open those cases, always spirits link it to the suffering of those friends, brothers and sisters, how we consider all the people around the world. And when we care of those spirits with the fraternal dialogue, with the prayer, with the hands, with magnetic imposition, as in passes, the water magnetized, and many others, we can see the difference before and after this. And we are sharing this good results with my colleagues, for example, in Cardiovascular Congress and Psychiatry Congress, the best ones in different cities in the world. The seed of light, because this is light from the good spirits to us. The seed is the consoler, is the spiritism, is the understanding of the mechanisms of those troubles that we are observing during those years, causing difficulties to children, adults, adolescents, and many cases we are receiving to try to care. So I would like to remember this is obsession, this is spiritual problems, all of this are consequences of the lives that we are living in the last millenniums here. So we have many wars and different and important conflicts around the world, as we have in Ukraine nowadays, but not only. We have in Yemen, we have in Syria, we have in Myanmar, we have in different countries. We have cataclysms, earthquakes. For example, in the last days in Syria and Turkey, recently in Pakistan, with many and many deaths because of the earthquake, floods, hurricanes, frequently in the United States of America, as Ian, Irma, Katrina, as you know. With Emmanuel, we learn about the linking in terms of psychosphere, obscure, a dark psychosphere, because we are living our lives far from the idea of enlightenment, acting to the other people against the divine laws that we learn too in the Spiritism. So, my friend, we need to change our mind. We need to be sensibilized to the spiritual spiritist learning. We needed to change. We needed to incorporate those fantastic ideas about the reality on earth to change in this reincarnation. And in the future, big changes are in our inner world, waiting for us. Do you understand? I would like to tell to you another time about how we can help big contexts of suffering with collective drama. For example, in this slide, the same mediumistic meeting, including our colleagues in the Spirit Society, we put to help contexts. For example, nowadays in Turkey and Syria, to help the discarnated one, to help the hurt people because of the buildings causing suffering to them. We have very nice things to do with the tools that we have because of the Spiritism in the frontier between spirituality and matter. So this is a very interesting issue to invite us to study together in the future, if you want, naturally. For example, current and recent times, epidemics, pandemics, COVID-19, depression, anxiety, suicides, autism spectrum disorder, cancer. We are looking the growing of the number of cases of cancer around the world. But in the same time that we are obtaining a fantastic development, growing of the cancer science, oncology around the world. Independent of this, including in terms of preventive disease, preventive medicine, in the prevention of cancer, the number of cases week by week in all of the world is growing up. Urban violence, drug addiction, drug trafficking, militias, corruption in politics, moral deviations, pedophilia, femicide, all of this are here in this world, independently of the knowledge that we have in terms of cause and effect, in terms of the idea of all of this. We have obsession. We have influence, especially from the spirits in the other side of life, in terms of the common world, in material world where we are, all of us together now. In the Spirit's book, in that famous question, do spirits influence our thoughts and actions? So the answer, in that sense, their influence is greater than you think, because very often it is they who direct you. And the humanity do not understand, do not know, do not study about spiritual reality, not only in terms of the influence in this material world, but in all of the fashions and different aspects that we need to understand to a better life. Because this knowledge, it is some kind of vaccine. We understand the vaccine in terms of 19 COVID, in terms of many important viral and bacterial diseases. But in terms of spirituality, obsession, we need to understand that this is medicine. This is preventive medicine. To understand the mechanism of relationship between that word, the spiritual word, and this one, where we are here now. Because when we care in terms of how to prevent obsession, this is one issue that in the future, we are doing this now, but we will see this one in the schools. We needed to offer to the children, to the youth people, in terms of this very nice, beautiful, and important context in terms of knowledge about ourselves and the mechanisms. Because if you ask my colleagues far from here in terms of the medical causes of many and many different problems, common problems, for example, hypertension, diabetes, cancer, they don't know the relationship of the bad spirits in this world acting in a way that can change, they can change the biology, the genetics, the cell. So here in another book, The Gospel According to Spiritism, Allan Kardec, evil spirits sniff out the wounds of the soul as flies sniff out the wounds of the body. So we need to understand the causes and the attraction of the spirits, the discarnated ones, in terms of our physical life here. Why they are interested in ourselves. Why they feel that it is something like fine to them to influence us. We need to study this, to try to understand and to develop this kind of preventive medicine. Because if you continue only to care of the intrinsic mechanism of the cell in biology, tissues, organs, and organic systems, of our physical body, if you do not valorize the perispirit and the soul, the main aspect of our lives, we will stay in the same reality for many centuries, maybe millenniums in the future. But as we have Spiritism, the consoler, we have contents in terms of culture, in terms of knowledge, understanding reality, to change everything. Let's go. I'd like to share with you that I am trying to contribute with some kind of research, some kind of discussing, sharing one typical spiritist experience of one work group, independently in Brazil or in different countries where I visited, to share those things, not only in terms of theories, but especially in terms of practice. Because we need to put the theory to benefit the people. And when we did, we can see the changing. And because of this changing, we understand the value of studying obsession, the influence of the discarnated in some kind of anonymous influence, because the people commonly, they cannot see the nurses, the doctors, the health professionals. They commonly, they cannot see the spiritual environment of each one of these patients. Do you understand? We have a big isolation because of the limitation of the condition to see by commonly people, not mediums, the spiritual reality. So medical people, researchers, they only could feel, sense, look for, detect, analyze material world. But we are changing our mind. Here, the little one, because we could stay in Poland, in Italy, in Argentina, in Canada, in the United States, trying to discuss about this seed in medicine. For example, very quickly, because a limited time, here, 15 years ago, the first World Congress that I visit by a suggestion of a psychiatrist, my colleague in medicine from Argentina. I stayed in Beijing, China, sharing with those colleagues in the 5th World Congress of Psychotherapy these experiences about how to deal with the discarnated spirits, and then what the benefit from this. Let me show you. This is the title slide. Allan Kardec Spirit Society, but National Institute of Health, because of health ministry, where I stay during all those decades in Rio. spiritual approach of mental diseases, obsession. So, with my colleagues from many different countries from the world, the incidence and prevalence of mental diseases are growing throughout the world, and their causes are not yet clearly established, in spite of the recent advances in modern psychiatry. And the therapeutic outcomes are disappointing in many cases. So I present 15 years ago the first 36 cases of different mental diseases. For example, depression, panic, schizophrenia, autism, bipolar disease. And I talk to them about mediumship, mediumistic techniques. So, how to stay with the spirits. Talking with them about what kind of this is the spiritual world. Who are the spirits, the discarnated ones? What they have, the linking from how, when in the past to stay with us in the context of our lives nowadays. They are now in a spiritual reality. That is a world parallel to ours. They interfered psychically in the lives of the patients, causing harm and maintaining the symptoms of specific mental diseases. Obsession. The ties between these spirits and the patients were established in previous lives and old reincarnations. Do you understand the courage, the security to share these contents with colleagues in medicine from different countries with some kind of happiness to share with them, to benefit the understanding about the reality. Because if you know, when we try to understand the causes of the main diagnosis in medicine, including psychiatry, my colleagues, specialists around the world, they don't know. They understand in terms of neurotransmitters, in terms of problems, in terms of intimate structure, in terms of neurological tissues in different areas, from the cortex to the main cerebrum in terms of other structures. But this is one attempt to understand. But we need spirituality. And in the same context, we need to study obsession to understand the mechanisms, to understand the relationship in terms of cause and effect law, and the suffering that we have now, including big problems in terms of the nature that we are commonly experiencing in this world during all the millenniums in the history of the humankind. This humankind on earth. So in terms of benefits, in terms of statistic, in terms of a little expression, in terms of results according to diagnosis. Here, I was sharing with them about Allan Kardec and Spirit's book, about centers for spiritual treatment, some specific characteristics, about spiritual centers, spiritists. Who is Allan Kardec to them? How we can give to them one idea of the mediumistic meetings to the people that do not know nothing about this. Our colleagues in medicine in China, different hospitals, spiritist hospitals. I trying to share about reincarnation, immortality, and many spiritist ideas about the reality with them. This is one slide that I present to them. This one, in terms of the Spiritism Mediums book, and I giving thank you to them, finishing my talk in that Congress. But here, Lisbon, I stayed in Mexico, I stayed in Madrid, Spain, but in 2019, before the pandemic, in Lisbon, this one, World Congress of Psychiatry. This is the higher forum in modern psychiatry around the world. This is a poster. And in this poster, I share with the people in terms of influence of discarnate people in mental disease and its respective approach. And in the resume, I talk about Allan Kardec, Chico Xavier, mediumship, spiritual reality, influence, and I present cases very typical of this approach. And the people, very impressive, because who is this doctor from Brazil talking in this manner in terms of spiritual world, spiritual influence, obsession? Yeah. It's interesting to remember with you, my friends, that the merit comes from the higher forum, the World Psychiatry Society, because they are very criterious. But always when I share with them, when I tried to stay with them in different cities around the world, always they accept my modest contribution. Do you understand? Because this is another time in medicine, especially in cardiology and psychiatry. Let me show you this. When I stay during some days in Lisbon, in that Congress, I know about another one, the World Psychiatry Association, promoting a new one only in terms of spirituality and mental health, spirituality and psychiatry. So, because of this idea, I program and visit for the first time Jerusalem and share with all the colleagues interested from many countries in this frontier between spirituality and psychiatry. For example, autism are one important challenge to medicine, to psychiatry, and to many other areas of caring our children around the world. We have one exponential number of cases in all of the countries in the world, including, obviously, United States of America. The influence of spirits in autism spectrum disorder patients and the benefits of psychotherapeutic approach to the spirits. This is one seed from spiritism, from many spirits related to the spiritism, but during the recent years, trying to share with us very beautiful knowledge and understanding, but here the practical experience to deal directly to the spirits linked to the children inside or with this important diagnosis in medicine. This is the Brazilian team in Jerusalem in December 2019. Friends in Jerusalem, all of them interested in psychiatry and spirituality. Last year, 2 papers to Bangkok in Thailand in terms of general psychiatry and in terms of autism specifically. The emails, according with the idea of the presentation in the last World Congress of Psychiatry. Well, my friend, I would like to tell to you the idea of many case studies, but I understand that if you want, we can share, we can stay here to ask some questions or some observations and contribution of your understanding in terms of this. And case study we can do in another opportunity if you would like. Thank you, my friend.
Sérgio, olha,
Oi?
o pessoal quer ouvir o case study para fechar. Se você tiver um para fechar, eles estão preferindo.
Okay. One case?
One case. All right?
Yeah, I have 30.
No, just one.
30?
We'll take a course later, but just for today, as a teaser.
30 in this presentation, because we have,
No.
well, let me show you one case very emblematic.
Okay.
When I visit Australia many times, because Spiritism trying to share the Spiritist seed with our colleagues in Sydney, Melbourne, and many different cities in the country. One time I received, I remember 2014, one phone call from Viviane, and she asked to me how I could help her, because she was coming from the ultrasound examination because of the recent pregnancy. And I was hearing, she told to me that when the colleague examined the head of the fetus, he could detect a very large lateral ventriculars in the brain of the embryo. And he told her that never he could see something like that, and suggest one specialist. She goes to the specialist, and he do not know about that. This is one kind of malformation in terms of anatomy of the brain. And she was very anxious because he would be the second son. The first one, completely fine, 3 years old. And then I promised to her that I will open the case in the next mediumistic meeting. And then I did it. When I opened the case, let me emphasize, I do not open to the mother, Viviane, Brazilian couple with Thalys in Sydney. I open to the fetus. Do you understand? Because another life, and the life with a brain problem inside the uterus of Viviane. When we open in a group, a war, Vietnam War, and this spirit that are reincarnating, he was a pilot, a fighter in a plane in the Vietnam War. And frequently he acts with some hate to that people in the Vietnamese agriculture work. Rice, Vietnamese situation of culture in terms of fields of rice culture. So, because of the bombs with a high dextrative power, we could see mediumistic in the spiritual reality. Dozens and dozens of dead people. And because many years after the bombing, they were in the spiritual realm in a very darkness situation, in a big suffering with blood, with the lack of many parts of the body. the perispirit, because all of them, they are disconnected with a big suffering, hungry, one devastation in the spiritual reality too. And because of physics, because of idioplastic, because of some understanding in terms of laws that describe not only the physical world, but the spiritual world too. I love physics. I am a physicist too. We can create some kind of fields of benefits that permit a very quickly recovery in terms of the perispirit, in terms of the physical aspect of those spirits, but in moral terms, because we deal with spiritual love to all of the victims that we share during the meetings. We could see the linking, some kind of cord, many of them linking dark, linking between them, victims of the bombers, with the spirit that are trying to reincarnate. We care always of all of them in each case that we enter with the group, the incarnated group, but obviously the disincarnated good spirits that are doing the best to the recovery of all of them. Okay, Viviane, do not share with me. She didn't call me during the next month. One time by Skype, I received another phone call. Dr. Sergio, my pregnancy stayed very fine. My new little boy, he was born very fine, but yesterday, in the 10th day, I and my husband, the father, we can note a very different movements in the head and in the arms of my friend named Luca. And I asked to him to know about that she and he, they could do one or more videos and send to me, because as a physician, I need to see the case. And this is the first video. I don't know about the sound. Uh-oh. Do you know these movements? No, because it's a very rare. When I saw this, I think in terms of extra-pyramidal syndromes, as, for example, Parkinson syndrome, or, for example, other ones, Chorea, Huntington chorea, Sideran chorea, and many others. And I understand because the lateral ventriculars, they are near the base nucleus. This is a very important system in terms of neurological physiology and health. And she continued to send me other videos. This is completely different. The head movements and the arms too. It is abnormal. It is one signal of some kind of neurological disturbance. Do you know? So I understand that I need to open the case again, more or less 6 months after the first one. And I opened. When I opened the case again, another war, another devastation. Many and many hundreds of victims. Not only because of this spirit, but because of many other. But they, especially he was not only during the orders from the superior in military army hierarchy. He presented some kind of hate to that victims. Many and many in the spiritual reality linked with the patient during the same minute from the action, the fact, the destruction in the war. This kind of link stay for years, decades, or centuries. Do you understand? Obsession. Frequently, we do not see spirits with the intention to cause some kind of harm, try some kind of vengeance. Only the relationship in the past, if it is contrary of the divine laws, we have some kind of obsession. So we care, but only one difference. We care of all of the things, but I have one intuition. It was not for the first time. We take the soul of the little baby in Sydney, Australia, to Rio de Janeiro, and I share talking with him psychophonically in a medium in the meeting. And when he comes as a youth adult. And we talk about wars, spirituality, reincarnation, medical problems, God, Jesus, and many nice aspects. He stayed very fine. But why I invite the good spirits to have the possibility to share with him? Because I create knowing about neuroanatomy, neurophysiology, one little brain by idioplasty. And when I finish this kind of construction, we can see light and light and some kind of leaf in that structure, because me and the good spirits, we are working together. And when he stay aside me, I connect this spiritual offering, one magnetic, fluidic, ideoplastic, new and perfect brain to adjust to that one in the perispirit. In the context of the perispirit that comes to Australia to stay some minutes in Rio, and then he sleep, and he was transferred back to the physical body. So let me show you, this is the third video before this second meeting to help him. The same movements. Well, the same. Well, this is 3 days after that meeting. Do you observe a different child? Because the eyes, here Viviane, the mother, and the father registering the video to send to me. And they are very happy because the difference after the second meeting to help the baby. Abnormal movements, never more till now. The doctors related to the case in Australia, they do not understand what happens. The same day of the bath, with dresses, difference of some days only. No tremor, no abnormal movement. Let me show you this. This is an image exam, 2014, from March to May, 2 months. The lateral ventricles are now of abnormal caliber. The visualized cerebrum and posterior fossa is normal. The midline structures in caudothalamic grooves are normal. The superior sagittal sinus is patent. This is in May, one normal result of this image examination. In contrary to that one in March, the colleagues, they do not understand till now. And the mother here, including by the pediatrician, the word miracle. This is Luca. some month after, because he's an Australian learning to surf in a very beautiful beach in Australia. In the next visit, and frequently when I go, I stay now in the home of Luca, Matteo, Viviani, and Talis. This is another case. Well, this is one interesting result. When we understand the suffering in humankind related to the lack of moral advancement, the lack of enlightenment, and the very, very frequent influence of discarnated people in obsession contexts in human life in general. Well, thank you so much.
Thank you, dear Dr. Thiesen. Thank you. So good to know, because how can we do mediumistic meetings if we have a group, right? We can't make it happen. So what he's saying, he has the group in the mediumistic meeting. It helps. It's like rescue work. We need these groups. And you see the changes in people's lives. Chico Xavier himself, right, Dr. Thiesen? We know his sister was having an obsession. Nobody understood what's happening to her. Thanks to the Spiritist treatment, Chico Xavier got to know Spiritism and became Chico Xavier. The same happened to Divaldo Franco and to many people that we know of. Thanks to serious Spiritists who commit themselves to this valuable work, we are at the frontier of humankind sciences, as Dr. Thiesen is doing, promoting it out there with other colleagues and friends from Brazil. So, time and again, we have to study more about these books to join forces and help, right, Dr. Thiesen? There's much more to know, but it's a great way to begin, to study the books, and as he said at the beginning, he repeated at the end, our imperfections are the magnet to the spirit. So if we want to get rid of it, we need to know ourselves. And if we know ourselves, we'll know the way in which we can protect ourselves and other loved ones as well at home. The power of prayer, the power of spiritist groups, the power of disciplined mediumship. So friends, the moment is very deep. We cannot thank you enough, Dr. Thiesen, but hoping that next time you come back in person. Right? Come back in person, right? As you wrote to me. So, I know we have more time. Anybody has a pressing question to ask? Yes, John?
When he took that, he went back in the lifetime of that child. I didn't understand how far back he had to go.
In terms of lifetimes?
Yeah.
Sergio, he's asking when you were going back to the life of that child, Luca, quando você foi assim, lá atrás, nas outras vidas, quanto tempo foi atrás? Do you know? How long?
The Vietnam War.
The Vietnam War, right? It was about the Vietnam War. Yeah, that's the American War.
That answers the question.
Yeah, okay, no, we got it. It's our war. It belongs to us. All right. So now we're going to say thank you to Dr. Thiesen. Thank you again. Everybody saying thank you.
Thank you.
Thank you so much. Right?
Bye-bye.
Thank you so
Thank
much,
you.
Sergio. We'll be in touch with
Bye-bye.
you.
Thank you so much for everyone. I love this meeting with you.
Thank you. We do too. Thank you. We'll be in touch with you for next time, all right?
Okay.
Now we're going to continue here with the passes, all right?
God bless you all. Thank you so much. See you as soon as possible.
Yes,
Thank you.
thank you. Bye-bye. Okay, so now we're going to end this.